It's fall, y'all. Today's episode of the Sami Cone Show represents a time of reflection and action as we transition to one of my favorite seasons. We start today's show by examining different healthcare coverage options, including how to save money even if you're not currently insured. Then I'll share tips on how to get the most out of the upcoming Amazon Prime Day. Next, I'm talking to the author of Spookly the Square Pumpkin about how to prevent bullying, along with some fun alternatives for Halloween this year. And finally, I'm teaching you how to make and freeze my famous homemade chicken stock. So put on a cozy sweater, grab a mug of chai, and get ready to learn something new, because this is the Sami Cone Show.
From the News Channel 5 Network, this is the Sami Cone Show, sponsored by Soundwaves at Gaylord Opryland.
Healthcare has been such an important topic, especially in 2020. So today I wanted to break down some of the options before you, possibly reevaluate your current plan, or look at why a healthcare sharing ministry may be a better option for you, even if you already have insurance. So I brought in a friend and an expert, Sharita Bent, to talk through all of this with us. Welcome, Sharita.
Hi, how are you? Thank you.
I am so glad that you are able to kind of break through the noise for us and talk through, especially this year where we're in the middle of a pandemic. Why is this such an important topic now in particular?
Yeah, absolutely. Thank you for having us, Sami. You know, we just love you and your audience so much. I think healthcare right now, we all know the system is sort of broken when you're dealing with insurance. It's hard for people to navigate and understand. And we just wanted to share that there are other options. You know, healthcare sharing is a really viable option. We're a vibrant community that's growing and thriving. And so just wanting to let people know, if you don't like what you have, you know, as far as healthcare, you got other options.
Absolutely. And I always tell people it's important to reevaluate your plans, whether we're talking about a magazine subscription or insurance, because you need to really know what's happening in these current times. Let's talk about savings. That's why people come to me. You can save up to 50% with a healthcare sharing ministry like MediShare. How is that possible?
Yeah, so with MediShare in particular, our members save up to 50%, and some of them save more than that. We've had many members who come and they've cut their premiums in half. And so, you know, maybe they were paying $1,700 before, you know, with insurance, and then they joined MediShare and they cut that in half. And we're able to do that for several different reasons. One, we have patented technology that really helps, you know, enable healthcare sharing. So it's secure, it's seamless. We're also a nonprofit, so we don't have, you know, like shareholders or a board of directors who are making decisions. We really just exist to serve our members.
It's incredible. And I think there's some myths that go around. You know, you think about having to go to a doctor, negotiate a rate, and get reimbursed. That's not the case with MediShare, though. Tell us more.
Correct. Yeah, correct. With MediShare, we negotiate and take care of all of the bill sharing. We do that for our members. So when you go to the doctor, you just show your MediShare card and we take care of everything else. It's really seamless. That's not the case with other healthcare sharing ministries, but with MediShare, it's very seamless. Also, you don't have to pay up front. Some, you know, healthcare sharing ministries, it's self-pay. You have to pay everything up front, and then you have to wait to get reimbursed. So we have a really seamless, you know, easy process for our members that's really technologically relevant, you know. That's
really comforting. And another thing that's comforting is that you have, is this right, unlimited telehealth and even telemental health? Because I know so many people are afraid just to go to the doctor, right? Because they're afraid they'll get something worse if they go. So what are the telehealth options available?
Yes, we have unlimited telehealth, which means you can access board certified providers from your home, from your car, you know, anywhere. And most of the time you can get treatment, get a prescription in less than like 30 minutes, and it's unlimited and it doesn't cost you anymore. So that's another way our members save money. And then same thing with telemental health, you know, access to professional counselors who can serve and support your mental health wellness. And I'll say, you know, we've been around since 1993, and we've been, you know, in the telehealth, you know, in the telehealth space. For some people, it's newer and they're maybe beta testing or, you know, just stepping into it. But we've really mastered it. So our members really do enjoy those features as well.
Well, and I just, I think mental health is now becoming normalized, thankfully, that people are realizing because we've been at home, but this is something that has been so important. And now to have unlimited access to that is just something that I love about MediShare. Another thing I love is the community aspect of it, that it reflects my values, that you've got that support system. We've got about a minute left, but can you just talk a little bit about that and the member voted guidelines?
Yes, absolutely. That's another thing. Our members love how much they can save. They've changed their lives with the savings. But when you can connect with other believers who can pray for you, support you, encourage you, and members are able to connect to whatever degree that they feel comfortable. We don't share any, private information or protected medical information, but we support one another and pray for each other. And then our member voted guidelines, our member voice is what matters. And so when you're in MediShare, you're a part of creating the community. You know exactly where your dollars are going because you have a voice, and that determines what's eligible for sharing is our guidelines. And that's also a unique factor for MediShare.
Oh, Sharita, thank you for just clearing through the noise, for breaking it down. I just feel like we've really been able to equip our audience. If you want more information, make sure you go to medishare.com/Sami Cone or Sami-Cone. You can also text Sami, that's SAMI, to 474747 to learn how you too can save up to 50% off. Thank you so much, Sharita. It's been a pleasure, as always, to speak with you.
Thank you.
Have a blessed day. We'll be right back.